This is an interesting case. Individual is 57 years old and had a motor vehicle accident in July of 2013. And he's had a hard time getting effective care. And I'll start off by showing you his pain drawing. He has numbness in both legs. And has symptoms of pudendal neuralgia. And has urinary frequency. I'm going to focus my findings on the lower half of the body, and the camera angle does seem to capture the fact that his left foot points outward more so than the other one, and this one points out at about 45 degrees, and this one is not quite as much, perhaps 35 degrees. If I try and rotate his leg internally, I can take it to not more than 10 degrees, and it's a very firm end feel. And on this side I can roll it in a little bit further to about 20 degrees, but there is a tight end feel. His subtalar joint on both sides lacks eversion, and I don't know if this is developmental. It also lacks abduction. I can't get any movement. You should have seen the foot go outward. In terms of inversion, he's got some inversion and he's got some adduction. But that's very rigid. Most interesting is the considerable rigidity in his pelvis. And I'll show you the tightness in the sacrotuberous and sacrospinous nerves. And the pudendal nerve does traverse between those nerves, between those ligaments rather. In supine, if I try and glide his pelvis from left to right, it's extremely rigid. Trying to move his pelvis right to left, I'm putting about 50 pounds of force and there's just no give. It's extremely rigid. If I try and rotate the pelvis posteriorly, there's no give and no give here. This is a very rare pattern in a male. I see this in slender females who have either delivered a very large baby and caused the sacrum to wedge posteriorly, effectively locking mobility throughout the SI joint. I also see it in women who have had a fall onto their buttocks. And this individual had several falls in his childhood. And that certainly may have contributed to this. Certainly the motor vehicle accident may have as well. Let's have you lie on your stomach, please. So I'm not able to get any force transmission through the pelvis. I'm trying to spring his sacrum. I'm putting at least 30 pounds of force. Trying to get anterior rotation of his ilium. Trying to get inferior glide mobility. And I'm trying to get superior glide. It's just extremely rigid. His trochanters sit fairly posterior. And whether this is developmental or through repetitive traumas, we don't know, but we'll certainly see if we can change that. And I'm trying to spring the trochanter on either side, the hip joint. Not much movement. Sacrotuberous ligament is right here, and it feels like bone, but there is no bone in this location. This is a ligament that's very, very tight, and then if I slide up from there sideways, I can isolate the sacrospinous ligament, and that also is very, very tight. And we're going to ignore his upper body, though there are issues to work on up there. I just want to emphasize the remarkable rigidity, primarily in the pelvis and in the hips, and also in the subtalar joints. And we're going to treat this and see if we can affect it. And my ultimate goal is to see if we can reduce pressure on the sciatic nerve at the level of the piriformis muscles. If it seems reasonable that that could be contributing to his lower extremity symptoms, especially given that his MRI was a negative, and as was EMG and nerve conduction velocity testing was negative as well. And I also hope that we can take compression off of the pudendal nerves and soften the pelvic floor, which is very, very tight given this rigid pelvis. And we will see what we can accomplish, and we'll film the results. Thank you.